A urinary tract infection, UTI, is an infection of your bladder, urethra, or kidneys. UTI are common and usually harmless, but they can also be life-threatening. What is a UTI? UTI happen when germs, usually bacteria, enter the urinary tract through the urethra or bladder. They can spread to the kidneys and ureters, causing severe infections, and may need treatment in the hospital. Bacteria in your body can cause a UTI, especially if you have a condition like diabetes or cancer. They can also be caused by viruses or fungi, often in people with HIV or other diseases that weaken the immune system. Women are more likely to have a UTI than men, because the female urethra is shorter and closer to the anus, or back passage. This allows the bacteria to get into the bladder easier. Other factors that increase the risk of UTI include a woman's use of a diaphragm for birth control, smoking, and use of a catheter, a long tube with a flexible opening to deliver urine. What are the symptoms of a UTI? The most common symptoms of a urinary tract infection are pain, burning when you urinate, and an urge to urinate often. Other signs and symptoms include a fever, chills, vomiting, nausea or diarrhea, blood in your urine, or an abnormal color of your urine. How can I treat a UTI? Antibiotics are the most common way to treat UTI. A doctor will prescribe an antibiotic that is right for you, depending on your symptoms and any other medical conditions you have. The medication works by reducing the number of bacteria in your body, which stops them from multiplying. It's important to take all of your antibiotics as prescribed by your provider, even after you start feeling better. Drink lots of water, too, so that the bacteria are flushed from your body. What is the difference between a simple and complicated UTI? Most UTI are simple, meaning they are caused by the same bacteria. When a UTI is caused by a different type of bacteria or is complicated by other medical conditions, the antibiotics may not work. For these complicated infections, the physician may choose a special antibiotic, or may need to order tests to make sure the antibiotic is working effectively. How do I know if my UTI is serious? If you have symptoms of a UTI that are not relieved by taking antibiotics or by other treatments, call your healthcare professional. You may need further testing, such as an ultrasound or CT scan of your urinary tract. In addition to antibiotics, your doctor may prescribe a heating pad or other medicine that will reduce pain and inflammation. You may also be given a diuretic to help you keep urinating, and drinking more fluids can be helpful.